glycogen supercompensation, meaning we're overcompensating and filling up and maximizing our glycogen stores. There's a few ways that this has been tried throughout the evolution of carb loading, I guess. But the main idea is that if we can maximize the stores or even go above that typical maximized storage form for us, that we can maintain our pace for longer amounts of times if we're endurance athletes. We can, again, have that higher glycogen to lead us to increase our time to exhaustion. Carb loading has been shown to be effective for those who practice intense endurance training greater than 90 minutes, and that's important to note. Carb loading is not recommended across the board for any athlete. The reason why this works is because it can increase the activity of glycogen synthase with the endurance training. It allows our specific muscles that we use in training to have the loading or the supercompensation because of the increased activity of that enzyme. If we're doing some more short duration, maybe 20 to 30 minute runs, maybe up to 45-minute runs, this may not actually be beneficial because when we store more glycogen, we store more fluid. Our limbs may just feel heavier. They might be a little stiff because of that. And in a short duration activity where we wouldn't actually tap into that extra storage of glycogen, it wouldn't be beneficial and would actually kind of weigh us down. Another instance in where we may actually see carb loading is in bodybuilders if it's done closer to competition and used to increase muscle size and appearance. So this doesn't lead to a gain in strength, but again, if we're thinking about the storage of glycogen and the storage of water that goes along with that and kind of the bulking up look to increase, again, that appearance of the muscle size. So to review, if we are recommending carb loading, the most evidence shows that it would be beneficial for endurance athletes training over 90 minutes. Our initial kind of classic carb loading regimen is a 6-day time frame in which we would deplete our glycogen stores 6 days out. Basically, we would exercise. We would consume a low-carb, high-fat diet with exercise for 3 days, utilizing those stores and not sufficiently replacing them. We would then consume a high-carb diet for the next 3 days with rest. So we're resting, we're not using as much of those stores, but we're filling them up and overloading them. When we do this regimen, again, it's 6 days. We have to have 3 days of rest before competition. So a problem that may be occurring is that we have to taper our training too far out. Planning to do the 6-day change in our intake may be too cumbersome. And so we're looking at a revised method that may be a little bit more appropriate for our athletes and more realistic, I guess, for them. So again, we still want to taper training on consecutive days after our glycogen depleting exercise. So we're still looking at reducing training, increasing our intake. But we're doing a normal mixed diet on the first 3 days and then a high carbohydrate diet the last 3 days. We don't want to necessarily deplete those stores by limiting our carb intake and continuing to exercise in the way that's described in the classic carb loading. An example might be on day 1, we're going for 90 minutes. We're training at 70% of our VO2 max. And we're having that mixed carbohydrate source. So it's not actually a low carbohydrate intake. It's maybe lower than what this athlete needs on a daily basis, but it's not low by any means. So this is where we're kind of getting our mixed source when we're looking at our grams per kilograms of 5 for days 1, 2, and 3. We see also that on day 2 and 3, this athlete can decrease the training to a shorter duration at the same intensity. When we get to day 4 and 5, we're still training, we're still tapering that down on same intensity, again, just less time doing that, smaller duration, and we're increasing our carbohydrate intake at this point to 10 grams to kilogram. Again, for this athlete, day 6 would be just one rest day, and then with competition the following day. So, some downsides to this is that glycogen storage occurs slowly. So it does take 2 to 6 days to super compensate. It's not something that occurs as rapidly as we may like. We need to plan for this. We need to actually practice this before putting it into effect for competition. Because if we do feel stiff, if we feel sick, if we just feel like our energy isn't there and our performance is low, then that's going to negatively impact our competition. Athletes also might not want to alter their training in that way right before competition. Again, that's why I always encourage practicing with something like this beforehand. When we are looking at our stores within 24 hours and kind of changing those stores and seeing what we can do at that point to have minimal disruption in training, that's something that we can see kind of coming down the road, and maybe some explanations and some shorter term loading, carb loading, that we can start recommending. Essentially, when we hear something about I'm trying to think, like a pasta dinner that maybe we did in high school before games, or maybe some teams are still doing that now. The idea is based on this carb loading principle that we want to super compensate our glycogen stores, and eating a pasta dinner may fill them if that's what we need, but it may not necessarily be classified as carb loading or have the same benefits as our carb loading protocol of those 2 to 6 days may have. And again, this is only going to be for our endurance athletes greater than 90 minutes of activity at a time, or our bodybuilders looking to bulk up more specifically. So moving on from kind of manipulating the macronutrient and our intake and our exercise to a little bit more specifics about supplementations. The first group we're going to talk about is going to be amino acids. There's a variety of supplements that we have read about, heard about, and so we're going to talk about the most common, and then at the end of these next few slides we're just going to sum up what the most recent recommendations say about some of these. So beta-alanine is an amino acid supplement. It's found in protein foods. It claims that it is the rate-limiting step in our carnosine formation. Essentially, that is used to buffer our acid and help maintain pH so that we don't end up being fatigued from our acid balance being off. The dosage that has seen to be effective and safe is 6 grams of beta-alanine a day for 2 weeks, and then 4 grams a day. This has been shown to be effective in athletes performing high-intensity exercise. And again, that's key, those high-intensity exercises. When we're looking at our next supplement, HMB, or beta-hydroxymethylbutyrate, this is a metabolite of leucine, and it is theorized to minimize muscle protein breakdown. So the idea again behind this is if we're consuming this supplement, then we don't have as much protein breakdown, we can maximize synthesis. A safe dosage is going to be 3 grams per day into 3 1-gram doses. And what we're seeing is that in untrained individuals, it may show small increases in strength I don't know if we have enough information for trained individuals. Again, this wouldn't be harmful, but to have that specific ergogenic aid and increase in muscle strength, we don't have that strong evidence exclusively. Where I have seen this utilized as well is in a hospital setting. If we have an elderly person that is in a hospital bed for a period of time,